This is an eccentric strengthening program for the elbow. This is indicated once the patient has an all acute inflammation resolved, and we still do not want the patient to actively perform any concentric contractions. Patients who suffer from lateral epicondylitis will want to perform eccentric wrist extension, and for medial epicondylitis, they will want to perform wrist supination.
All right, so we're gonna have our patient seated here, have their wrist off of the table, and for this, we're gonna use a hammer for more of our functional goals. First, we can have our patient do wrist pronation eccentrics. So we're gonna have the patient start here, and I'm gonna ask the patient to slowly turn their palm towards the ground. We're gonna go for about a 4 count. And once they reach that end range motion, basically parallel here, it's really important that I move them back into the starting position because we don't want that active concentric contraction. So slowly lower it down to get that eccentric. Good. And I'll move them back up. And then from here we can do supination. So we're going to have the patient go the other way, slowly for a 4 count. And then I'll move the patient back to starting position. We can also do this for wrist extension and flexion. So we'll have the patient move their wrist here. And for eccentric wrist extension, we'll have them slowly lower their wrist down. And I'll pull them back up. We'll do that one more time. Good. And then we can have them flip their forearm over. And then we will slowly bring the wrist up into flexion, ask them to slowly lower it for a 4 count. And then I'll bring them back to that starting position. Good. And we want to do all these exercises. We're going to do 3 sets of 10 repetitions because it's not 5 and it's not 15.